Government, we all know, plays a vital role in this overall process, working with the private sector, but that vital role in the discovery, development, and delivery of drugs and devices is something that does need to be modernized with time as we have these advancements in terms of methodologies, in terms of treatments, in terms of the lightning speed, the skyrocketing speed with which new applications and devices and information technology is advanced. The government plays that role in lots of different ways, but a fundamental role is the one of focus today, and that is the Food and Drug Administration, the FDA, which is that regulatory agency that oversees the safety and the effectiveness of those medical products and drugs and devices before the American people in this country. As a former member of Congress, Bart Gordon and my co-chair, we talk frequently about it. We are very sensitive, very aware of the role of government. And government can either incentivize and accelerate and lower the barriers, or government can stifle industry growth and hold back and rein back those advances which science really has out there, which can be made possible if we get rid of those barriers. In a sentence, I think the easiest way to think of it is that we can't rely today on 20th century technologies of the 1900s, at the time the FDA was, the regulatory structure was put in place, when the world is changing so fast and when the world really is on a cutting edge of new health technologies, including medical science and including information technology. Fundamentally, we've just got to modernize, bring up to date the way that drugs and devices are developed and delivered in this country. And it's time to act now, and we'll talk about the global implications and the global competitiveness, but the time is to act now, as you do have millions of patients out there waiting for cures which are on the shelf and ready to go.
Now, I have a specific request to make of Bill and Bart and Janet and all of you who are working on this. I'm going to stay and listen to the panel because I want to devote more structured time to learning what to do. But I would like for you to take the excellent recommendations that you've made in this report and boil them down to specific recommendations that we can send to Legislative Council. Okay, here are 10 specific things you should do in this Senate legislation that would meet the objective of aligning federal policies so that we can get cures, treatments, and other discoveries through the whole process and into the medicine cabinet more rapidly and at a lower cost.
Across the medical and research fields, as Fred and I found, experts from all different backgrounds and all different sectors really agreed about the meaningful improvements that we can make. And today's report that was released, I haven't read it in detail yet, but I've read the executive summary, and it really offers us a lot of the same proposals. It echoes a lot of the things that we heard in the House and then acted on in H.R. 6. I'm also really encouraged that our efforts have been joined by serious discussions and working groups at the Senate Help Committee, and the Bipartisan Policy Center's initiative really adds that substance, expert analysis, and further momentum to the conversations.
Our focus this year in the Help Committee should be on giving FDA, patients, and our life science companies clear rules of the road for a sector that sees over $100 billion in biomedical investment from the public and private sector. It is a sector that we lead above all other countries in the world. We're also trying to tackle economic and innovation issues in the areas of lab-developed tests. Our nation's leading laboratories and medical device companies need clarity about what needs to be regulated by the FDA and what might not need to be regulated by the FDA. This must be done with an eye towards safety and innovation so patients have access to the most cutting-edge precision medicine tests. When I first got here, there was a lot of discussion about how to strike that balance, and we do need to strike that balance, but we also need to realize that therapies that are unavailable to patients are also therapies that create a lack of safety or threaten people's lives, because if they can't get access to it, it has the same result. Finally, as the report very helpfully acknowledges, we need to have the conversations around how to incentivize companies to focus on the hardest conditions in our country to treat. When there are more than 10,000 conditions for which only 500 treatments exist, we know there's a lot more to be done.